So that way you can kind of have a second item on it. We can figure out what we're going to do after that. So
One of the rough offices.
Yeah, cleanup is always.
oh, but you know what? I was so sore on Monday after tossing those garbage bags. But you know, it feels good to do it.
And Veteran Standing Committee to order. Per request of a member of this committee, we're going to do a roll call attendance.
Carrie Severson. Not present. Ingrid Glassbrenner.
Here.
Timothy Gotchel.
Here.
Donald Seat.
Here.
Ken Renish. Dr. Gerald Barris. Cindy Chicker.
Here.
Sherry Hilsheen. Lee Van Landwit. And Francis Brathwaite.
Thank you. So that takes us to Pledge of Allegiance. Mr. Seep, would you be able to lead us in the Pledge of Allegiance?
Yes, I. Where's the flag? You're facing right now. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Madam Chair, your mic must not have been on. I couldn't hear you.
Okay, maybe I'm just not speaking close enough. Can you all hear me? Okay, all right. Thank you. Do we have proof of notification? So we have a 22-point agenda today. Can I have a motion to approve that agenda?
I'll second.
All right, motion and second. All those in favor, please say aye. Aye.
Aye.
Any opposed? Okay, also our previous meeting minutes. Does anyone have any comments or corrections? Otherwise, I'll take a motion to approve our last meeting's minutes. Thank you, Mr. Van Landite. Do I have a second? Thank you, Francis. All right, all those in favor, please say aye. Aye. Any opposed? Okay. Public comment. Do we have anyone here from the public or from our committee who wishes to speak as a member of the public? Or online? All right, hearing none, we'll move to item number 7, our 2023 VSO budget summary. Ms. Knott.
Okay, the paperwork has been submitted for the committee to review. If anyone has any questions.
So hopefully you all got a chance to review that. That was under items number 7 in our packet. Any questions? Otherwise, we'll let Ms. Knott give us her admin report. And then if you guys have any questions, you can ask at the end.
I also submitted the quarterly review for the numbers of office visits and the number of forms. It's, as far as the forms go, it really is hit or miss whether you're going to have a bountiful number of them. Just because we're not actually completing the forms at that time, that does mean that we still have a claim going with them. So right now the VA is starting to process forms for like February, March-ish. We have about, I think 39 was the last count of claims that we're consistently following, monitoring, and working on right now. Excuse me, FAIR took a lot out of my throat this last week. FAIR went really, really well. This year for a gimmick, for our little gimmick, we were giving away rubber ducks. And you would not believe we discovered so many veterans, younger generation veterans that we didn't know that are living in Richland buy those ducks. The children would come up to get them. We'd ask them if they had anybody in the family, and the dad or the mom would be like, yeah, I served. And we met a just incredible number of new veterans. We gave out pamphlets, brochures, so many of them that I took 4 boxes of things to hand out and came home with one box. That's how much stuff we handed out. And we're talking, I spoke with the core council, and I need to follow up with Candace a little bit yet, but we're, according to state statutes 45.84, it is under my job description, and we're going to be, they formed a committee that, to help purchase headstones for veterans that are buried within Richland County that don't have one. And like I said, I've worked with the Corp Council on this to make sure that I got the thumbs up. And the committee is a separate entity from anything to do with my job, but I am working in collaboration with them as per state mandated job description. So, and I'll be doing more follow-up on that. We're just getting this off on the ground, and we're hoping to have some results for Memorial Day next year. So besides that, it's just just another day in the office, I guess. If anyone has any questions.
Good morning, Karen. Madam Chair?
Yes, Mr. Seat.
Yes, I'm glad you had a good event at the fair. How many days were you there?
We were there every day.
Pardon?
Every day,
Oh, what is every day? Thursday, Friday?
September 6th through September 10th.
I see. And so was the office open at all?
Well, no, I mean, yes, it was, because twice a day in the morning and the afternoon, I would go back to the office to check emails and to return anything. We had a couple of veterans pass away during that time, so I had paperwork to do. So the office was open at parts of the day.
Get back to the office for an hour or so, I suppose.
In the morning and then in the afternoon,
I
correct?
see. So the office in essence otherwise was closed throughout the week.
There was a sign on the door telling them where to locate us.
Did you do you have an idea of what the expenses were for the fair setup? Did you have to purchase materials for your displays?
We printed off brochures. A lot of the things I save up as we go throughout the year. So a lot of the things that we handed out, booklets and stuff like that, I had already had it prior to fair because I knew it was coming. I can't think of any.
So you didn't have any expenses other than the diversion of salary to that purpose?
Yet.
Okay. And you mentioned in your report that you have 39 cases that are pending before the VA.
That are open, that we're
Open
currently
claims
working.
and are pending. They haven't been closed.
Correct.
Do you recall how many cases you've filed since January 1?
Are you referring to the
Another way, how many cases have been closed since January 1? Or you don't know that number?
Not right offhand. I mean, if I were to review the forms that
No, that's all right.
the
That's
quarterly
fine.
report of the calls, walks in and forms.
Yeah. And did you say that your quarterly report is not completed?
No, it's completed in the committee form.
Up to date?
Correct.
Oh, it is today. Okay, I just misunderstood you. You carry a big stick, but you speak softly.
Oh, I'm sorry.
So
The next one will be posted in January, as with the whole year's
you
numbers.
mentioned 2 meetings ago that you were going to submit the budget for 2024 for review by this committee. Has that been done?
I don't recall saying that. I did contact Ingrid prior to, and made sure that she had those sheets, prior
I
to
see.
submitting it.
I see. So are you going to explain this budget to this committee?
It's the,
Madam Chair, is the budget subject to review and approval by this committee?
The 2024 budget,
Pardon?
the 2024 budget.
Yes.
I don't think actually, I'm going to defer that to John Hook.
Madam Chair, you also carry a big stick, but I can't hear you.
Sorry, this is not carrying my voice as well. Is this better? Can you hear me? I feel like I'm going to eat the mic if I get any closer. Can you hear me?
I
Okay.
can hear you. It goes a little difference to my elder ears.
Okay. So I think we can review it, but I don't know that we don't actually approve that, do we?
And I can respond to that.
Thank you.
Thank you. So with the administrative form of government and with the change with Clint leaving and Candace coming in, we're making sure that we're following the statutes, and the statute says that the county administrator is the one that prepares and submits the budget to the county board. So we have done that. Candace and I and Derek have met with all the department heads. We have compiled what we have to this point. It was presented to the finance committee earlier this month. We will be tweaking a few things between now and the October meeting, the first week of October. And then it'll be moved on to the county board with action taken on the public hearing and the action approval of the budget taken on October 24th. There is nothing that prohibits any department head from providing information to the oversight committee as to what is in that budget. But the preparation and the submittal of the budget is by state statute to be done by the county administrator. And that's what we have done.
I can appreciate that, John. It would be helpful to, since there are 4 or 5 members here who are representatives of veterans, we have an interest in issues in the budget, and it would have been helpful, I think, for us to have an opportunity to have some input with perhaps the administrator and yourself.
Yeah,
and maybe that you are open to that.
Well, certainly, we seek input anytime, but the statutes say very clearly, and one of the things we're trying to do is, and Candace talks all the time about silos that have been created over the years, and we've had departments that aren't talking to each other. Things are getting approved without going through sometimes Derek, who is appointed as the finance officer and the county administrator. Some things were falling through the cracks. We're trying to make some changes this year. And to this point, everything that we have heard regarding the preparation and the submittal of the budget has been very, very positive from department heads and from county board supervisors. So I would also say that, and Karen, correct me if I'm wrong, and Candace, the budget for the Veterans Department is, I would say, status quo from prior years. There are no significant changes in that budget whatsoever. I think the other thing that Karen could probably do is provide a brief written report to the Oversight Committee as to what's in the budget. But there's no action that's required by this committee for the preparation of that budget. And I always tell people when they ask me the question about the county administrator form of government, the statutes are clear. The county administrator prepares and submits the budget to the county board. Once that budget is submitted, it is taken out of the hands of the administrator and it is now into the hands of the county board. And they can completely start over and create a new budget if they wish. We wouldn't recommend that. And we're also very proud of the fact of the budget, of how we did the budget process this year. It is a very responsible budget. It took away a lot of meetings, not only with department heads, but with other committees. It was, we believe, a much smoother process. And again, to this point, we've been hearing very positive things. But I think, it would be acceptable for Karen to provide just a summary of that budget, and that could be emailed to the committee.
So just to follow up, the budget process was very fluid this year. It was very fluid. It flowed wonderfully. There was no traffic jams, no red lights at any point, no bottlenecks. It was just great. So the only thing that has changed was the line item that was not taken out the year prior. So it was the committee transportation fees of that $900. That was the only thing that has changed in my budget besides obviously the salaries moving up and down. And I was going to prepare that after it was approved in October. I'd be able to share it with you and then answer any questions. So I did plan on doing that after it had been approved and preparing that for the October meeting.
Thank you, John. I don't want you to get the impression that I am protesting the process. I've been in absentia here for obvious reasons, and I appreciate your comments, and I fully respect the process in terms of the administrator's authority. So please don't have the impression that I am some way uttering a protest. It is a different sort of communication and than we've had in the past, because the committee has been very involved in the past in communication with the managers. The veterans who are on this committee are very familiar with the operations and the needs of the Veterans Service Office. And so when we're on the street and somebody asks us a question, it's helpful to be informed and to be able to answer their questions. I think you can understand that. Thank you, John.
Mr. Hookman.
And I would just say, I do appreciate those comments, and certainly if there would have been significant changes in this budget, you would have heard it, the committee would have heard it, but we weren't proposing any significant changes. And the next steps in the process is next week, Tuesday, Candace will be doing a brief PowerPoint presentation explaining where we are at this point. Once the board has that, and from then until October 24th, anyone that has questions should make sure that they talk to Candace or Derek or myself, or the respective department heads. So we're certainly not trying to cut the committees out. We're certainly not trying to cut any county board members out from having that conversation. We're trying to make the process a lot more efficient. And, I would say this, and with all due respect, is we all know there were significant budget issues in years past. We're trying to correct that. We're trying to make things a much smoother and a better process for future years. And hopefully in the end, we're going to have people that see that this was a much better process than what we had in the past.
Thank you. And Ms. Pesh, I am sorry, I did not mean to overlook you. You guys threw me off by not sitting next to each other today. I apologize. Mr. Van Landijk, did you have a question or a comment?
Just to get away from the heavy duty portion of this discussion. We had a beautiful weekend, and I'm glad that Karen had a good spot. We had wonderful weather, and I guess the piece that tickles me most is the fact that you found other veterans that have not had anything to do with the VA, per se. And so I'm happy that you were able to reach them. So thank you.
Yes, it was motivational. Seriously, it really was. So yes, I was indeed felt blessed that we could be there and to help those veterans. So.
All right, thank you. If there are no other comments, we'll move on then to items 9 through 11. Those are our consent items. Do any members of the committee have questions on those? Hopefully you had a chance to review them, or staff members with some comments on any of those items. I saw on the contract monitoring, there was a few that we were going to address later with our contracts. Right? If not, we'll go on to number 12, approve HHS contracts, agreements, and amendments.
So I'm going to apologize. We had none in August, so we're making up for it now. So we have 5 amendments. The first one is for the change group. We currently have a contract for them. We are looking for an additional $49,500 for services to be provided to CCS or Comprehensive Community Service consumers in the Behavioral Health Services Unit. The next one is for Forward Home for Boys. We are requesting approval to enter into additional funds for an additional $10,000 to provide group home services to children being served by the Child and Youth Services Unit. The next one is Cholita Institute. We are looking for additional funds to increase care for children being served in the Child and Youth Services Unit there to $300,000. The next one is Platteville Family Resource Center. We are requesting approval to go into an additional funds to for increased need of psychological tests for parents and children being served by the Child and Youth Services Unit. We're looking for $15,000. And the last one to be amended is the Wisconsin Family Ties. We are looking for $41,000 due to increased care need for family and caregiver support children enrolled in the Children's Long-Term Support Services Program and the Behavioral Services Unit. I think we need a motion
Yeah,
for that.
for those separately. I guess just out of curiosity, do we have extra placements that created this increase?
So with both of those, it's the same placements, but increased need.
Okay.
For the one at Cholita, his needs have really increased. He will be leaving in November as he will be aging out. So in the meantime, we just need to make sure that they're able to staff appropriately to be able to meet his needs. Forward Home for Boys, when the original contract was set up, we did not have the 2023 rates. The state is pretty delayed on getting those to us, so we just need to make sure that we're have enough in that contract to cover.
Great. Unless there are other questions, I take a motion to approve those.
I move to approve the amendments to the contracts.
Thank you, Ms. Stricker. And a second? Are you giving a second?
Second.
Okay. All right,
Second.
discussion.
I'll second and ask a question. Are these all strictly just county funds, or is part of this being, I understand you're asking for this much, but is there also an increased amount that's covered with state aid too? Or is this 100% on us?
The two placements are 100% on us, and the other ones are pass-through funds through programs.
Can I add just a comment?
Yes.
So when you say state aid, we would, if there's anything left in our base county allocation, then we would claim all of those dollars and then apply them to the placement fund if there's anything left out of the base. So fingers crossed, if we can help.
Right, any other discussion? Right, all those in favor, please say aye. Opposed? Okay, so new contracts, Jamie.
The first one is Roots Residential Adult Family Homes. We are requesting approval to enter into a contract with Roots to provide group home placement services for adults being served by the Behavioral Health Services Unit. We are looking for $100,000 for that one. The next one is Ferguson Consulting. We are looking to enter in a contract with Ferguson Consulting to provide mental health therapy clinical supervision for staff providing mental health outpatient therapy to persons being served by the Behavioral Health Services Unit. We're looking for $2,500 in that one. Our House Senior Living Memory Care. We are looking to go into a contract with Our House to provide community-based residential home placement services for adults being served by the Behavioral Health Services Unit. We're looking for $26,000 on that one. Red Maple Consulting Services. They will be providing psychotherapy, psychoeducation, substance abuse and recovery planning, community skills development, and wellness management to CCS consumers in the Behavioral Health Services Unit. We're looking for $49,500. And Whispering Pines Custom Builders, we are looking to go into a contract with them to provide home modifications for children enrolled in the Children's Long-Term Support Programs in the Behavioral Health Services Unit to not exceed $5,000.
Questions?
Yes, these new contracts, are they all done with an RFP and 3 quotes, and like especially the Whispering Pines, was there 3 quotes on that?
Do not believe so with the Whispering Pines. I would have to double check. Sometimes with the CLTS program, it goes off of what the family wants. So if the family and it's state funds that fund it, if the family says this is the provider we want to work with, that's typically what we go with. If we need to do the 3 quotes, that is something we can start to work on.
And so some of these were CCS. Those are funded, is that correct?
Those are funded, correct.
Do I have a motion?
So moved.
Mr. Van Landai, and a second? Thank you, Francis. Any discussion? Yes.
If I may, are any of these things, any of these items compensated some by the state? Do they do matching or do they do anything to help us out with these monies?
Well, like I said, the CCS, so the Red Maple would be fully reimbursed, correct?
Yep, Red Maple would be fully reimbursed, Whispering Pines would be fully reimbursed, and Roots Residential would be partially reimbursed.
Fantastic. Thank you.
Madam Chair,
Mr. Seep?
yes, just to comment in reference to the question about RFPs. I think in this case, there's somewhat of a nuanced approach to this, I believe. It's not a black and white issue of looking for the best three bids. I think it's within the prerogative, I believe, of the director with the expertise inherent that given cognizance of her budget, that they are determined to look for what is the most appropriate service at the most appropriate price within their budget. I don't think there's a requirement, and it hasn't been in the past. I think it's just rather automatic that the director is looking at alternatives and trying to find the most appropriate alternative vis-a-vis her budget. Now, am I correct in that, Trish?
So if it's for client services, you are correct that, we do allow the consumer to pick their provider and let us know, and then it's federal and state funds that reimburse. If we were going to do a remodel at our building, that's something we would definitely then get quotes for. But if it's for a consumer, then we wouldn't.
This is just, I don't know if this is going off topic a little bit, but if we were doing that process, isn't there also a certain dollar amount too? Like if it's below a certain amount, you don't need to get RFP or bids? Am I correct? Okay. Alrighty. We had a motion in a second, correct? Okay. All those in favor, please say aye. Aye.
Aye.
Any opposed? Okay. Number 13, approve modification of the HHS addendum to the employee handbook.
So what I have found is in January of this year, the staff authorization table changed the grade for the APS workers and the CPS workers and our mental health therapists. One thing that we did not do when we did that was for those who are therapists in training or have their temp certified social work certificate. They were a grade below. When the reclass came in January, we didn't move the temp certified or those in training. So they're now 2 grades below. So we're asking for a modification of the handbook that moves them up to just 1 grade below and have it worded that they will always be 1 grade below the position that they were hired for if they were fully certified or licensed. There are a couple of other minor modifications as long as we were doing this that I looked to the handbook. Currently, when there's family medical leave paperwork that's submitted to the clerk's office, in our handbook, it said that that medical paperwork needs to be submitted to our office. We're asking that that be removed. That should all be handled at the clerk's office. And then we are also just made a change to the handbook to clarify that if somebody does move or have a new, any new information, a marriage, a name change, anything like that, that the county handbook is followed, and then it's also that they notify the confidential administrative secretary in our office. But I really wanted to make it clear that they have to notify the clerk's office here. That's really the most important. And then the final change is our handbook says that we shall put all ads in the newspaper, where the county handbook is a may. So we're just asking that authority to shall instead of may.
Okay. This looks pretty straightforward. Thank you, by the way, for preparing it. It was so clear. I'm assuming this is already
Yes, Candace and I have talked about.
Okay.
This, yes.
perfect. Anybody have any questions? All right, can I have a motion to approve this? Thank you, Mr. Enish, and a second.
I'll second.
Thank you. Any further discussion? All those in favor, please say aye. Opposed? Number 14, approve the 2024 to 2028 Richland County Coordinated Transportation Plan. Is that Roxy?
Yeah, but she's not able to be here, so
Okay.
I'll cover that. So every 5 years, we have to do a new transportation plan. What happens when the plan is being prepared by Southwest Regional Planning Commission? They get together with the counties that are a part of it, and then each county does their own public meeting to get input from the community to really draft and set a plan for what should we be working on in the next 5 years. So the plan was attached in the board packet, and we're just asking for this committee to approve that plan.
Do you know if it had changed much?
I don't think so. I think typically a lot of times those goals really remain fairly close to the same. I honestly didn't do a comparison with last year to this year. I apologize.
No, that's
For the last 5 years to this one.
Hello, everyone. My name is Jacqueline Asando. I am on the WebEx.
welcome.
I'm from Southwestern Wisconsin Regional Planning Commission.
Thank you for joining us. Did you want to comment on this? I know you guys were
Yeah.
participating.
So the 2024 plan is not so much different from the 2019 plan. The major difference is the public input that we did this time around that led to the identification of needs and gaps, which the goals and actions for this next 5 years is based on. We had the public input, I believe was April 18th. We had sent out invites to over 200 people. We had 26 people in attendance. A good section of people from providers to people from nursing homes. We had very good input, which basically led to the identification of the needs and gaps, which are on page 13 of the plan. So with Richland County, the needs basically were the fact that we don't have enough drivers. We need drivers, we need volunteers, and also services for instance, workforce transportation, transportation of bariatric individuals, and after hours transportation, which is needs to be available, and just expanding transportation if we have enough funding. As was mentioned before, the needs are not so much different from what was done in 2019. Richland County would continue to provide these services, and as and when funds are available, would expand. The major difference this time around was, I would say, a more regional approach when it comes to providing bilingual services, and then also the workforce transportation. That's like the major difference with this plan. Yeah, that would be it. As was mentioned before, we're basically looking for an approval by this committee, and then to take it to the county board next week for the approval.
Thank you, Jacqueline. Did anyone have any questions for her or for the director? Okay. If not, can I have a motion for approval of this transportation plan?
I so move.
Thank you. And a second? All right, any further discussion or questions? All those in favor, please say aye. Any opposed? Okay, thank you again, Jacqueline. And
Thank you.
Approve 2024 vehicle lease agreement and MOU.
So through the 5310 grant services that the state has, entities are allowed to apply to get a vehicle. 80% is covered by the grant, 20% is covered by the county entity. Since we are the designated person, we have worked in the past with Schmidt Woodland and with Pine Valley for them to be able to get a transportation. And so we have a lease agreement with them. They do cover the 20%, not us. And they make sure all the quarterly reporting happens. And so we just want to get approval to continue those lease agreements.
So both Pine Valley and Schmidt cover their own, is that what you're saying?
Yes.
Yeah.
Yes. Yeah.
I move for approval with discussion.
Thank you, Mr. Seep. Do I have a second?
Second.
Okay, Mr. Enish?
Yes, Madam Chair. Trish, do you have an approximate dollar amount that the county would have to spend?
We don't have to spend anything for these. This is just the agreement. Pine Valley covers all their expenses.
I see.
Yep, Schmidt Woodland covers all their expenses, and even when the vehicles were first received through the grant, those entities covered the 20%.
So 80% of it is covered with the grant? you
Yes.
said,
Yes,
And the other 20% is covered by Pine Valley?
yes.
Thank you, Trish.
Any other discussion? All those in favor, please say aye.
Aye.
Opposed?
Okay.
Number 16, approve the 2024 treatment court grant. I believe this is Brandy.
But I'm actually gonna take care of
Okay.
it. Last month when we brought this to you, after the fact, we realized that we had incorrect numbers in there. So the amount of county levy that we had in the last one was about 8,000. That's what we aim for and that's the goal. But if one person who's on the committee is no longer able to, our in-kind amount drops and then our amount of county levy has to go up. So these are the correct dollar amounts that are there. So the county match will be up to 28,523. I just really wanted to make sure that we had that correct information on there. If it's needed, that we have that correct amount. So I'm bringing that back to the committee and then we'll take it to full county board next week.
Okay. A motion? Thank you, Mr. Gotchall. And a second.
Second.
Mr. Rathway. Okay. All those in favor, please say aye.
Aye.
Number 17, approve comprehensive community coordinating committee membership list. This one's Brandy.
So per state statute, our CCS program requires us to have a coordinating committee. Unfortunately, due to COVID, they kind of stopped meeting and there hasn't been a meeting in, I think, like a year and a half. And they're supposed to meet quarterly. So we've been working on coming up with new committee members and getting it up and rolling. The goal kind of the committee is to monitor quality assurance, monitor the plan, review policy, any changes to structure, things like that. Our committee is going to be made up of some HHS staff, therapist, a service facilitator, some consumers. Those can be in the program or family members of those in the program, and then one of our HHS committee members.
Okay. All right. So I noticed on the list it said Dr. Barris and Richland County Board. I think we just need to change that.
And correct the spelling of his last name.
Yeah. Did you catch that, Dr. Barris? We're looking out for you. Okay. So with those amendments, do I have a motion for approval of this list or any questions, I guess?
We should have Dr. Barris.
Yeah. Yeah. Do you approve? Okay. Thank you. Thank you, Mr. Van Landijk. All right. All those in favor, please say aye.
Aye.
Any opposed? Thank you, Brandy. All right. Number 18, approve resolution to honor I don't know how to say her last name, I'm sorry, Shaw, okay, information and assistance specialist.
So Karen worked for the county for 33 years. She did retire last week, so we're just asking that there be a resolution taken to the full county board to honor her time with the county. She was a great employee, very dedicated to the people that she worked with. Really was what we want for employees as far as her work ethic, her commitment to the community, her commitment to the county. She will definitely be missed. So we're asking that the resolution be taken to the full county board.
Thank you. Yes, Mr. Van Linde.
Support those that have served well, and I would.
Thank you. Do I have a second?
I'll second.
I think Ms. Tricker beat you.
Also.
Yes. All right, all those in favor, please say aye.
Aye.
Any opposed? And thank you to Ms. Karn. All right, that takes us to number 19, which is our director report.
So you have the written updates in the folder. A couple of things I just really want to point out is that in our behavioral health unit, we think this is the first time since maybe 2015 that the unit has been fully staffed. So we're very, very excited. They have a great group of workers down there who are really working well together, learning the programs, learning all the expectations, and really doing a fabulous job. So we appreciate that. Treatment court is also almost to max capacity. So this is the fullest that treatment court, I believe, has been since it started. We're getting referrals, and they're really, it's been good. They've been moving people into the program and working with them. So that's a wonderful addition to the community. Our public health nurse, last month, we reported that she was going to be starting, and she decided 4 days beforehand that she was going to be taking another job. So we are doing interviews today for the public health specialist, and we are doing a little bit of reach out. It's flu season coming up. We definitely need 2 nurses to be administering the vaccines. And so we will be looking to have somebody come in and just help short term with the flu vaccines, because that is a service we have to provide to the community. And let's hope that the public health specialists that we're able to hire 1 or 2 through this process. A couple of other things that we've done. Jamie and I met with Mike Wendell to review our base contract for the contracts that we have every year, just to make sure we're in compliance. So there's a few changes that we are making, and all staff have been working very hard on getting information so that we can get contracts prepped and ready to go for 2024. We are in definite need of home delivered meal drivers. We've been struggling to keep people, struggling to make sure that everything is, that we are meeting the service and we are providing the meals, but we're having people do double routes. So if you are aware of anyone who is able to help out, wants to volunteer, please send them our way. And then yesterday, Brandy Christensen and I went to a one-day conference on mental health and the law. It was very good. We did get some information. We just really are trying to make sure our clinic is in compliance and that we're in compliance with all standards and statutes. So that was a great day for us. We came back with a lot of information.
Thank you. Any questions for Director Tricia? All right. Number 20, review and discuss the 2024 HHS budget. Were there any changes from last month?
There are no changes. We just wanted to bring it back if anybody had any questions, comments, and to let you know that everything is remaining the same as of right now.
Okay. Yes, Mr. Hoekman.
Just a comment based on the question that Supervisor Seep had before. I just wanted to say that, and I know Candace feels the same way that I do, the approval of the budget, of the county budget for us here in Richland County happens in October. But as far as the budget process, that is an ongoing process that never stops. We do a 5-year capital improvement program, which is great. And not all the departments are doing that for the full 5 years. That's something that we want to move forward. that we have a better idea of what our capital needs are, mainly because we've had so much deferred maintenance throughout the county. But I don't ever want anyone to think, whether you're citizen members on a committee or county board members, that we do not seek your input. Input should be provided to us if you have something that you want us to know year round, not just at budget time. So we're not attempting to cut anyone out of the process. We're trying to make the process run smoother and be more effective so that there's additional resources that we can provide to our residents and to our taxpayers. And a final note on that with, when we looked at the budget, and Candace and I had an opportunity because we're coming in with a fresh set of eyes to look at things. Most of you probably remember the directive that the Human Services Department was directed to cut 5 positions this year in this budget. We have not had to do that. So the budget that will be going to the county board does not include any reduction in positions. I think that's a great thing for the county. It's a great thing for the Human Services Department. So there are things in this budget, and the process for this budget may have been a little bit different what you've seen in the past, but we really think it's a step in the right direction, and we want to do even more, but we don't want to give anyone the opinion that we're not looking for your input. We desire that input anytime throughout the year. So thank you for that.
Thank you, Mr. Hoekner. Number 21, future agenda items. Does any committee member have anything they want to add to our agenda for next month?
Can I just talk about something I'm encouraging?
Yes.
Placements that we kind of didn't really discuss, number 10. I look at the adult crisis stabilization. It's called, what's going on there?
Answer, I just plugged the numbers into the spreadsheet.
I think we have been, we have a full-time crisis worker. We have 2 mental health therapists in the clinic. And so we've really been working with people when these calls come in, when reports come in, and really trying to find solutions that will help and assist them in the community. We're really looking at least restrictive. And so if there is a way that we can keep people in the community and keep them safe, we are doing that. I think there were a couple people that went to Winnebago in those months. And so those are the ones where we have no other, there really is no other choice. There's that safety concern to themselves or others. But as far as that crisis stabilization, we've been trying to utilize community resources and keep them in the community.
What remarkable.
Right. Anyone else? Okay. Still relatively short on time. Okay, so our next month meeting will be October 12th. So I have a motion to adjourn to our next meeting on October 12th. Thank you, Mr. Enish. Second? All right, all those in favor, please say aye. Aye. All right, thank you guys.